Hello and welcome to Inside Edition, where we discuss national, regional and international issues in depth. The vast spread of COVID-19 pandemic caught much of the international community off guard. However, the Kingdom of Bahrain enacted an early prevention and preparation phase with various procedures and decisions to deal with COVID-19 and to ensure the health and safety of its people and residents, marking another story of success in terms of combating the spread of COVID-19 and decreasing its impact on both individuals and the society. As a result, the World Health Organization, the WHO, launched a case study documenting Bahrain's strategic response to the pandemic, showcasing how the country managed to overcome critical challenges through preparedness and early response. To know more about that, we are pleased to be joined here in the studio by the WHO representative and head of the office in Bahrain, Dr. Tasneem Atatra, right after this. The World Health Organization has launched a case study documenting the Kingdom of Bahrain's successful response to the COVID-19 pandemic. The study specifically details the Kingdom's extensive efforts put in place to combat the spread of the disease and highlights the best practice examples and lessons learned from the pandemic.
It is a role model, I would say. With all the experiences that the world had with dealing with COVID-19, Bahrain stands out as one of the best practice kind of experience because we cover all the aspects. I will say we had this ideal public health action that we did during the COVID-19. We started early, we planned, we prevent, we did establish testing centers. All of these actions were harmonized in a way. The dynamic of doing this where though it was centralized, but at the same time it was harmonized within the government, within the society, the engagement of everybody.
The information of this case study will further stress the fact that healthcare remains a priority for the government of Bahrain and that the commitment at the highest political levels were vital to the success of Bahrain's COVID-19 response under the leadership of His Majesty King Hamad bin Isa Al Khalifa and the constant follow-up of His Royal Highness Prince Salman bin Hamad Al Khalifa, the Crown Prince and Prime Minister.
The leadership was the success or the key to have this success story. We established the task force, the national task force, early on, before at least 3 to 4 weeks before the first case of COVID-19 diagnosed in Bahrain. And from that day, we prepared as a team, and if I'm referring to we, as I always refer to Bahrain team, we prepared ourselves for the next cases because we knew it will come definitely to Bahrain. So the task force established, the preparedness started. Welcome back. Joining me here in the studio is the WHO representative and head of office in Bahrain, Dr. Tasneem Atatra. Thank you very much for being with us, Doctor. Doctor, first of being here in Bahrain now and hearing and seeing all of the precautions and things that have been done during the pandemic and now also at the end effect, hopefully, of the pandemic and everything that was put in place. Can you tell us about the reasons and the significance why the WHO selected the Kingdom of Bahrain as a case study and what is the success story in dealing with the pandemic that Bahrain has done?
I'm really pleased to be part of the WHO team who supported and worked on launching this report. It shows that leadership and commitment and partnership are essential for a successful response. In Bahrain, under the lead and guidance of His Royal Highness Crown Prince and Prime Minister, there was a multi-sectoral committee and a national task force that was established when even the novel virus was announced. And even before the first cases in Bahrain were announced. And Bahrain moved swiftly once the first case was announced on the 24th of February. And this really shows that Bahrain was able to manage it with strong preparedness, response, ensuring that all services are provided free of charge to all citizens and to all residents of Bahrain.
Yes.
What was special about Bahrain, that all testing, vaccination services were provided. In addition to, they ensured the continuum of care, where Bahrain succeeded in ensuring the provision of essential health care services. Preparedness here was really a critical element to make this response really outstanding, because they ensured preparedness, response services, and at the same time ensuring that they engaged all stakeholders, ensuring a whole of government, whole of society approach. Yes. All these factors made this response outstanding and worth documenting to be shared with other countries around the globe.
That's amazing. The report is actually part of Bahrain's contribution to contribution to the exchange of global best practices to strengthen health emergency preparedness and response across all borders. What is the importance of exchanging and spreading this kind of knowledge, this kind of acquired knowledge?
We saw through this pandemic that no one is safe until everyone is safe. Yeah. And through this report, we are looking at increasing exchange of information, exchanging of communication between countries, because this can also help other countries to learn from good practices and lessons learned to be able to advance their response equally. Yeah. And this pandemic has shown how it affected health systems across the globe, and many health systems were negatively affected. So when we are documenting best practices, is a way of increasing communication between countries. And this is also one of the things that we at the World Health Organization are working on it, is to ensure that we are providing a platform for countries to exchange, for countries to advance collaboration and partnership towards health for all by all.
Absolutely. One of the things that the Bahraini practice really excelled in, and you mentioned this, is the intercooperation between the multidisciplinary teams being governmental entities. So there was a lot of interaction between the Ministry of Interior, the Ministry of Health, the Ministry of Information, in order to get the information out there, to get the correct information, and to keep people safe, so to say. One of the humanitarian concepts as well was that not only were people provided free health care and free vaccinations to everybody, whether they were citizens or residents or even undocumented residents that were here in the country, everybody got a free treatment and vaccine. From your point of view, how important is that kind of collaboration and kind of work together, cooperation between internal government agencies for the well-being of people living in the island?
What we saw in Bahrain with this multi-sectoral collaboration is the commitment and is the share of responsibility. I witnessed it as I arrived 1 year ago in the amid of the pandemic. I saw how everybody is working hand by hand, and I saw that the response was everyone's responsibility, and this is what made the response outcome successful. Yes. This multi-sectoral collaboration ensured that the provision of preparedness and response is comprehensive. Moreover, in addition to the work that was evident between all government sectors and between all key stakeholders, it also showed this commitment was also reflected on the community because of a long-standing trust between the community and the government. So the community also, because they received the information in different languages, in different communication channels, were also able to collaborate and were able also to take it forward. Like we saw in Bahrain that there was no hesitancy about the vaccination. Yes. When the vaccine was announced, we saw that the leaders were there first before anyone else. We saw His Royal Highness Crown Prince and Prime Minister, who was one of the first people to go and get the vaccine. Absolutely. And this showed an example for the people to follow. And we saw also the use of technology, which was also outstanding. The Be Aware app, where it provided people with information not only about the number of cases, but also where they can get testing services, where they can get vaccination services, and everyone had access to the information they need to act, to prevent, and also to ensure a healthy community.
Absolutely. Well, as the head of the WHO office in the Kingdom of Bahrain, how do you value the constant progress witnessed by the health sector here in Bahrain, especially in terms of not just dealing with any pandemic, but specifically COVID-19?
When we look at a health system, there are building blocks for any health system. In Bahrain, there was the testing services, which shows also the strong infrastructure of the laboratory system. There is the trained health workforce, and this was an extremely important factor. But moreover, there was the partnership between the different sectors. And on the top of this, there was also the role of volunteers.
Yes.
When we look at the volunteers who came and they were there in the front lines, trying not only to do their best, but also they were committed.
Yes.
This also shows how it's also important to look at this response as the success of the whole community in Bahrain.
Absolutely. When we look at the community of volunteers that were available, these volunteers were from all different backgrounds. You had nurses that just graduated, you had people that came out of retirement, and you had people that didn't have any kind of relationship to the medical field, but they were all willing to learn because it was a learning curve for everybody. It was new to everyone, whether it's a doctor, a nurse, or somebody that has nothing to do with medical. Volunteers were trained and they were prepared to take that kind of training. How important is it to come up with these kind of new procedures in order to keep uphand on all of the newest information when it comes to COVID-19 or other pandemics that we see coming, or other illnesses that we see are coming in?
An engineered response is the response that depends on data and depends on information.
Yeah.
So what makes any response more proactive is the fact that it is being based on research, based on the up-to-date information that are coming also from credible sources. During the pandemic, as it was a novel virus at the beginning, and then information were unfolding. Right. So there was also the importance of ensuring that this provision of information is also provided timely and feeding into decisions of how to advance the response based on this information that were provided in reference to research and evidence to global protocols and guidelines, where at the World Health Organization we were working with our global experts and regional experts and country experts across the globe on a daily basis to ensure that we are providing countries with this information. In Bahrain, Bahrain had an active research team who were ensuring that also they are contributing using also methodologies that are globally of global quality and standards, to use that to feed into the response. So we saw that also there was a press conference where this information were transparently provided to the community. We saw also the traffic light, which also was using the data and the information to how to provide the response in a way that also protecting the community and protecting the people, but also ensuring it is the responsibility of everyone. So I would really highlight here the importance of information for action.
Absolutely. When it comes to information for action, transparency is really the key word, because people want to know what's going on, because they will see things on the side that they do not understand. So having that awareness and making these kind of awareness campaigns where everything is set on the table is very vital. What can you tell us about the reaction that you have seen from the society of Bahrain to the guidance of the government in overcoming this pandemic?
I can also share my own experience. Even before I came to Bahrain, I downloaded the Be Aware app. And I was really astonished to find everything I need on my mobile. Moreover, when I came here and I saw in the streets or even in the social media information available in different languages, this was really important for me, just to ensure that no one is left behind, that the information is there for everyone, especially that they use different platforms, social media, newspapers, different media channels. So this ensured also the wider coverage and ensured that the message is tailored for all age groups, for people coming from different backgrounds. So this was really outstanding. Yes. And here, please allow me to thank you and to thank all the colleagues who are working in media, because you all did a great job. Like we saw in other countries how the infodemic had a negative effect and a negative impact on the response to COVID. In Bahrain, the media with the community, under the leadership and guidance of the Ministry of Information and also all the responsible leaders, we saw a different story where everyone was working in a harmony to ensure that it's health for all by all.
Absolutely, thank you very much. Well, the existence of the WHO country office actually facilitated a 3-level mission of the WHO staff members from the country office. The WHO actually regional office and headquarters to produce a detailed account of Bahrain's operational strategy in continuing the spread of the disease. What can you tell us about that?
The mission came in a critical time, was where it was for other countries, like especially we had our global experts. So we when engaged WHO headquarters, it means that we also ensure that we have global experts. So sharing also and bringing a global lens to look at this response. So it was really difficult because in other countries there was travel restrictions. In Bahrain we didn't experience that, but for other countries it was really hard. And then we also ensured bringing regional experts, working with the country office team, which was just also established. So for me it's a whole other success story, not only for the WHO country office, but also working closely with Bahrain to ensure that we are bringing global experts, regional experts with the country office experts, working together, documenting this success. And here it was like also critical because it was at the time where the country office was established. And one of the core goals of this office is also using Bahrain as an incubator of success. And what does this mean as an incubator of success? Is ensuring that we are documenting these best practices and lessons learned from Bahrain and sharing it with other countries in the region and globally. So this is one of the main goals of the country office. So making this mission possible and later working on this report to be launched is one of the biggest achievements of the country office, of course, which will never be possible without the lead and the support of the government of Bahrain. So thank you for the government of Bahrain for documenting their best practices and for sharing it with the region and the globe.
Definitely. One of the other international recognitions that Bahrain has received, and specifically from the WHO itself, is that Manama was actually recognized as the healthy city, or as healthy city by the WHO for its commenting or its commitment to creating an environment conducive to human well-being. The first Middle East capital to earn this distinction was actually Manama. So what can you tell us about why is that significant?
Let's go one step backward. What do we mean with a healthy city? To have announce a city as a healthy city, there is usually a number of steps where the country is completing sort of an assessment, answering certain questions, reporting on number of indicators that are looking at the provision of different services in a comprehensive, holistic approach, ensuring a safe and a healthy environment, which is not limited to health only. So it looks at different factors. After that, there is a mission of experts that they come and they do an evaluation using a standard tool and meeting with the different committees that have been working or assigned to inform into these different aspects of answering why a healthy city is a healthy city. And accordingly, after looking at this score, when any city is scoring more than 80%, then it is announced as a healthy city. So there is a process behind it. And this process is also a learning experience by itself, not only for the team who was working on it, but everyone who is engaged to make this possible. For Manama, as the first capital to be announced as a healthy city, it is not only one more achievement that is contributing to the long record of achievements of Bahrain. It shows again the importance of the multi-sectoral partnership. It is another lesson learned and success story of how Bahrain has provided a platform for all the different sectors to work together to ensure that Manama is a healthy city. And this is also again showing that different ministries, with the governorate, with the municipalities, even with the private sector, are working together to contribute to that.
Definitely. One of the things here in Bahrain that we are very proud of are our community healthcare centers. Community healthcare centers during the pandemic provided vaccination. They provided primary health care for people that came in with symptoms, and for people who came in with symptoms but did not have COVID, reassurance. The doctors, the nurses knew the people in their community. There was this cherished relationship. And having community centers is important, especially in a country like Bahrain where community is very important. What can you tell us about the importance of having that kind of relationship between the healthcare system and the community where these centers are in?
This is another way of saying that right to health is evident, because how we define the right to health. Right to health is about availability of the service, access to the service, where here access is not only physical, but it's also access to information, financial access, where services are also provided free of charge. It is also about acceptability, where the services are being provided in the community by members of the community. And last but not least, it's about the quality, which comes from ensuring that they have a well-trained health providers who have the tools and the capacity to provide this service. So looking at all these factors together, the first thing that came to my mind while listening to you, it all basically shows that right to health and the provision of health services that are ensuring the right to health is all being provided, ensuring that it's ensuring the rights of everyone to access healthcare services. And here, please allow me to add one more thing. When we are looking at the services being provided at the community for the community, it ensures that no one is left behind, and also it ensures that people are able to have this interaction with their health provider. And this interaction will also ensure that people are going to the health facility as early as possible. And these health facilities are not only providing curative services or treatment services, also they are providing long list of preventative services. So when we are looking at the vaccination services in Bahrain, and Bahrain was even one of the first countries to achieve global targets in terms of expanding vaccination, COVID-19 vaccination, this also shows that this also built on the strong vaccination campaign and the services that already they had in place. So it shows also the strong health system that was in place. And then during the pandemic, health facilities were repurposed. They ensured providing all health workers with the required protective equipment. They ensured testing services are available. And in addition to the community service, I still want to, if you allow me, I want to thank also all the team who are working on all these testing centers, regardless of the weather. Even in the hot summer, you will go around the clock and you will find them there in that open areas, standing there with a smile, professional, guiding you to where to have the, like even with this drive-through service.
Yes.
I think this is amazing.
Yes.
Because really it helped all the community to access the service in a timely manner, and at the same time ensuring that they are getting the quality service by being also protected.
Absolutely.
So people didn't need to go to places where it's crowded and increase their exposure. On the contrary, it ensured that people are protected, they get the service, which is quality, and ensure that it's available around the clock. And again, using the technology, because we used the Be Aware app to make our appointment.
Absolutely. I mean, you hit it really on the point by saying healthcare for all. That was really the target that was being provided by making all of these changes, like the testing centers, the drive-through testing centers, making them available in different medical centers around Bahrain, where you can go get tested and it will come in the Be Aware app. So having that communication even between private and government sector is as well important. And also, because of its importance, healthcare for everybody is one of the SDGs. And the UN SDGs, or Sustainable Development Goals, this is something that Bahrain is really working on achieving by integrating them into their own national goals. So how do you see that taking place, and how, especially for health care and well-being, how do you see that becoming or actuating in the future?
We can't achieve the SDG that is relevant to health without also addressing all the other goals.
Yes.
So achieving universal health coverage would require also achieving the relevant targets that are relevant to education, environment, food and agriculture, etc. So and equality and all these other targets.
Yes.
So the Sustainable Development Goals are indivisible. And to achieve one, we need also equally to work on all the other Sustainable Development Goals. And we saw in Bahrain how the national plans and the national strategies were providing a structured roadmap towards achieving them.
Right.
And already Bahrain has scored high in number of them and achieved them while we are now in 2022, but achieved number of the targets before even 2030.
Yes.
And this also shows how it's important to look at partnership and all sectors to work together and collaboration, ensuring leaving no one behind.
Definitely. When we look at the SDGs and the way they were basically fulfilled or slowly are being fulfilled, we see that even the community has a big role in fulfilling these kind of targets or these goals, whether they are the national goals of Bahrain itself for 2030 or they are the United Nations SDGs. What can you tell us about coming up with innovative ways to fulfill these SDGs using technology, the importance of educating and spreading awareness in order to fulfill all of these goals?
First of all, let's go back to the how Bahrain is reporting on the SDGs. So there is a specific designed platform where Bahrain is basically reporting on all the progress in SDGs. Yes. And this is really important, where in addition to the transparency, which we already addressed earlier today, but it also shows the commitment of the country of how they are progressing to achieve targets. Yes. So this would be like really something that we need also to tell the community that Bahrain is telling the story of how step by step they are addressing all these different SDGs. But again, when it comes to the innovation is about doing the right thing in the right way. Right. It's about effectiveness. It's how actions are being also cost effective. Yeah. It shows also the importance of the different sectors working together. Again and again in our talk today, we come to the importance of partnership, collaboration. These are really the key elements of any success. Collaboration, partnership, leadership, it all makes any response more successful. And then when we go back to the health system, for any health system to be resilient and sustainable, it is really important to look at the continuous work, looking at advancing the qualities and the capacities of the health worker, looking at ensuring that they have the tools and the infrastructure to be able to do what they need to do. And all the time, it's also important to ensure that this communication between the health providers and the service provider is there, this channel with the community, because it's again a whole of society and a whole of community approach that makes the real innovation happening. And in Bahrain, we are talking about a global community.
Absolutely.
In Bahrain, the resident of Bahrain and the citizens of Bahrain, we can see like people are from all over the world. So this is also again which takes me to the right to health, how Bahrain is ensuring in their health service delivery that it's acceptable, that it's available, that it's accessible and of high quality standards, by also taking into consideration the diversity of the community in Bahrain.
Right. My next question to you is, when we look at the community, there were certain people in the community that were very sensitive when it came to healthcare. So you're talking about children, the elderly, people with chronic diseases, and these people were getting the vaccination, or they were offered the vaccination. But globally, there was always looking or studying ways to provide them with the best healthcare that is proper for them, for people that are elderly, for people that have chronic diseases like MS, cardiac diseases, or anything like that, as well as children. How is involving this community, the community of people that have special needs, basically into the testing and vaccinations, as well into keeping them safe during the pandemic in all countries, not just Bahrain? But because you are here and because we're talking about Bahrain, what did you see from Bahrain's role in providing the health care for them at home, or providing the right information for vaccinating children, or providing the right kind of diagnosis for people with chronic diseases, when and where and what kind of vaccines to take? These people, the humanitarian concept, what do you see when it comes to Bahrain's role in feeding or in helping them achieve their health targets?
During the pandemic, like for example, patients with non-communicable diseases or chronic illnesses, they didn't have to go to health facilities. Basically, they received their consultation online or through phone calls, and then there was a door-to-door delivery for their medication. So I don't need to talk more about it. It talks by itself. It talks by actions of how the continuum of care, despite the pandemic, was operational in Bahrain. And this ensured health for all by all. It's also ensured that the population are being also protected and they receive the services that they need.
And you see that this was also one of the successful points of this case study of why Bahrain's experience was successful?
The case study looked at this success from different angles. It looked at what were the elements of the success or the successful response in Bahrain. It highlighted the importance of the leadership, the importance of the partnership, and this what we saw through the work of the National Committee, the work of all sectors together. It shows also the importance of the health workforce and how the trained health workforce were able not only to work under all this pressure and all this stressful situation for all, but also they ensured the continuum of care. And this would take me to the fourth aspect of the success of this response, is ensuring the continuum of care while ensuring testing services and advancing the vaccination coverage. As you already mentioned, Sara, the vaccination was provided to all citizens. Everybody in the country were able even to choose which vaccine they want, and then we all received the reminders about the second dose and the third dose. So the country is one of the highest countries in the region providing the booster doses.
Well, we're almost done with today's show, but before you leave us today, what can you tell us about the WHO's office future plans and upcoming projects here in the Kingdom of Bahrain?
The WHO country office in Bahrain, which basically now we are celebrating our birthday, our first birthday here in Bahrain after the office was launched last July. We have three main I would say objectives that are all together informing our strategy. So at the office we are looking at the provision of strategic health advice and also ensuring that we are bringing the global health expertise to work side by side with the team here in Bahrain. The second aspect, which is basically using Bahrain as an incubator of success, documenting Bahrain successes. So this case study is one of the products under this umbrella. And last but not least, no one can make it alone. So it's about partnership, working closely with all ministries, with all sectors, with the academia, towards advancing the realization of the Sustainable Development Goals. And this is all basically packaged in a work plan, where we have a work plan that was established and developed under the lead of the Ministry of Health and the Ministry working closely with the Ministry of Health team, where we have this work plan for 2022-2023, and it's basically there mapping out all the activities that we aim to contribute under the umbrella of achieving and advancing the realization of the Sustainable Development Goals of 2030.
That's amazing. Thank you so much for giving us this information and for being with us today, Doctor. Thank you.
Thank you, Sara. Shukran jazilan.
And we would like to thank you, dear viewers, for watching us, and we'll see you next week in another episode of Inside Edition.